Hi, my name is Katie McGinn, and I'm with the product marketing team at TeleTracking. We're excited to share with you a recording of a recent webinar where we had the pleasure of hearing from the Upstate University Hospital team speak about their successes optimizing throughput with the use of auto dispatch of transporters and the implementation of a Discharge Hospitality Center. In this webinar, you will hear from Kristen Wright, Director of Centralized Patient Services, Heather Wilkins, Manager of Centralized Patient Transport, and Kyle Choquette, the Associate Director of Nursing for Throughput Operations, as they speak about the challenges they were tasked with overcoming and the outcomes they have realized with the help of their incredible teams and the utilization of teletracking solutions. And now I will pass it over to TeleTracking's Global Clinical Executive, Maria Romano, to introduce the Upstate team.
You did a great job, and thank you, everybody. Thank you for taking time out of your schedules and joining us on this awesome webinar that I know many of you are going to be taking a lot of notes and want some follow-up after the webinar. I have the opportunity to work with Upstate, and Upstate is located in Syracuse, New York, and they are such a dynamic team. They work together as a dedicated throughput team, and their leadership really speaks to the testament of putting patient flow at the top, and it's one of their top priorities. And in the past 4 years as being their clinical executive at this organization, it's been my privilege because I also have learned from them that I can share with other clients. But today we have the great opportunity to introduce Kristen Wright, who's been at Upstate for 9 years. She's a director of Centralized Patient Services. Along with her, we have Heather Wilkins, who's been there 4.5 years, and she's the manager of the Centralized Patient Transport Department. And Kyle's not on yet, but I'm sure he will be getting on. And Kyle Choquette, he is the Associate Director of Nursing for Throughput Operations, and he's been 14 plus years at Upstate. And again, I want to just go back to the privilege that it's been to be able to work with this organization. And today they are going to showcase to you the outcomes Kristen and Heather and Kyle have worked together with. But Kristen and Heather really directing this piece of the outcomes that they're going to share with you. I did want to just talk about that they spoke at NATM, which is the National Association of Healthcare Transport Management, this past May. And they spoke to so many different organizations about the environmental services and the transport outcomes that they have been able to provide at Upstate, and in conjunction with all the nursing clinical outcomes that they've worked together as one big village and a team. And so that's what I'm very excited about, what they are going to be sharing with the next steps. So now, Kristen, I'm going to hand this over to you and Heather. Have a great time.
Hi, thanks, Maria, for such a great introduction. Thank you, everybody, for joining us. I just want to talk a little bit about NATM before we start, just because the importance of NATM for those who aren't familiar with what NATM is. It's a great opportunity to get together with different organizations who have transport teams, and a lot of ideas and suggestions and process improvements are shared throughout that conference. So it's definitely something to check out if you're interested in kind of learning what other organizations do. And we always leave that conference with some new best practices. So I just want to put that out there to everybody. And I'm going to turn it over to Heather a little bit to tell you about Upstate Hospital.
Good morning. So like Maria said, we are located in Syracuse, New York, which is upstate New York. A lot of people hear New York and they automatically assume the city, but we are upstate, smaller city, but we are the trauma hospital. Okay, so level 1 trauma hospital. We get all the stroke center, the burn center, poison control center, lots of big things that happen for us. So it's hard to plan our days here, but we do the best we can. And we are a 19 county clinical catchment area with a population of more than 140,000. There are a lot of little rural places that we have a helicopter pad that we have patients that are flying into all the time, things like that, because there's lots of little places that need our help. So about the throughput operations, this is a huge team that has come together for us, and we've seen such a difference with having everybody together in this throughput operation. So we have the transfer center team, EBS, our transport team, bed board, everybody all in one station. So we can say we have a meth lab explosion. That was last week. And we have somebody coming in through helicopter. We have ambulances. We have all, and we can all talk. We can figure out the best thing to do, where to get them, how to get them there the fastest, and how we can be the best we can be as a team together. So we actually have two hospitals under Upstate. So we have our University Hospital, which is downtown, and we have Community Hospital. So University holds 387 licensed beds, Community 314 licensed beds. And then we also have Golisano Children's Hospital, which is part of our downtown hospital in the tower, which holds 71 beds. So we have primary care just for our little patients. So a huge place. Not listed in here also is our cancer center, which was built on. So we are out of space. We have everything that we can possibly have. We would love to have more, but our hospital vision that we highlight here. So we will provide comprehensive, seamless, and innovative patient and family-centered healthcare to improve the health status of the communities that we serve. And our operations center motto, right patient, right location, right service, right time, every time. So like Maria said, very patient focused. We're very lucky that everyone shows up to do the same thing every day, and it's for the patient to be the best we can for them. And we really try to go forward with that. These are pictures of our hospital, our DHC. Okay, so this is a place that we have opened in each hospital that has really helped. I don't know how many people have a Discharge Hospitality Center. That's what DHC stands for. So basically, we've created a space for the patients that could be waiting for somebody. Maybe they're waiting for their medications to go home. Maybe they're waiting for their ride to get here from an hour away. So basically, this is a space that we've created to get the patients out of the room that they were receiving care in, because they no longer need the care, but they're actually not in the spot to go home, right? So they need a place that has dedicated nurses. It's got snacks, it's got TV. Our pediatric part has video games. Pretty sure there's some lavender scented diffusers happening. So it's a very comfortable spot that it gives patients that one step closer to feeling like they're out of a hospital room with a stranger, and just getting to that place where they want to be as home, right? So our occupied timer is really huge, and this is how we got there. So I will let Kristen talk a little bit more about that. If you have any questions, feel free to put them into the chat and we will get to them as we go.
So I'll talk a little bit about our journey with TeleTracking. So TeleTracking really helped us develop a dedicated throughput team. And that was huge for us because it allowed a lot of areas that didn't really have the understanding of what the throughput issues are. It brought them kind of front and center to be able to allow us to work on them together. So as we began our journey with TeleTracking, we knew that we had some throughput issues. So our occupied timers for the adult ED, the peds ED, and the PACU, along with our unit-to-unit transfers, were noted to be well above our target goals mostly because of dead bedtime. So the dead bedtime was also noted for patients who are waiting for discharge, which is why we created the Discharge Hospitality Centers. So to allow that comfortable space for them to wait for them to be discharged. If you can just go to the next slide for me. So how we were able to eliminate and help reduce some of the dead bed time is we started to use the auto dispatch function of transport in from the TeleTracking capacity management suite. So it's a little bit different. We all know that TeleTracking already auto dispatches your jobs. But this allows us to put in, if a patient is ready to move from the ED or unit to unit, it automatically puts in that transport request. So it doesn't require somebody to have to enter that, which is huge for our transport team. So they're able to get those requests faster. We're able to move the patients sooner than what was happening before when we were relying more on our clinical team to move those patients. So let's talk a little bit of our improvements for 2023. So we began in February or March of 2023. We looked at turning on the auto dispatch function from our ED to inpatient. So during the time frame from March to December, we transported a total of 3,964 patients, and our average occupied timer was 26.6 minutes. So previous to that, when our ED colleagues were doing most of the transports to put these ED patients and get them admitted, the turnaround time was 58 minutes. So that allowed us to save an average of 31.4 minutes per patient, which was huge. And we shared a little bit of, for us, our average cost of boarding a patient is $49. So we were able to save a significant amount in each of these areas, which helped us kind of justify needing a transport department at our other location for community hospital. So if you look kind of at these metrics, they're huge. So then we moved on to inpatient in June. So from June to December, we were able to transport 1,863 patients, and our average occupied timer was 30 minutes. Previously, it was 59 minutes, so we were able to save 29 minutes per patient, saving the 37.5 days with a total savings of $113,962. So with that, we decided as a group, as an interdisciplinary team, where else can we utilize this function? So we opened it up to our PEDS population. So we started transporting our PEDS patients who are waiting in our pediatric ED to their inpatient unit. So with that, we started that in October, and we were able to transport 321 patients with an average occupied timer of 27.7 minutes, which was previously 53 minutes, saving 25.3 minutes per patient. So anybody who's been a patient in a hospital knows that when you're waiting, whether you're waiting to go home, whether you're waiting to be admitted, whether you're waiting to move to a new unit, it can be stressful, and the faster you're able to get to the patient to where they need the right care, the better that is for the patient as a whole. So on the next slide, we'll talk about our continued improvements for 2024. So in 2024, we decided to begin helping out our PACU team. So we began moving our PACU patients to inpatient, to our med-surg areas. We began that in March. So this data was from March until May when we presented at the conference. And during that time frame, we were able to move 564 patients with an occupied timer of 23 minutes, reducing 15 minutes per patient. And same with, we saw our continued growth in both ED to inpatient, our inpatient to inpatient, and our pediatric to inpatient. And why this is significant, again, as we were able, because in the area of healthcare, we all know that when we're trying to put forth new initiatives and build new teams, such as our new transport team at our community campus, you most of the time have to justify or have an ROI. So we were able to use this information to justify starting our transport department at community hospital, which is huge for us. It was, we were able to successfully open that in May. So what do we look at? So there's a lot of different reports and dashboards that we utilize in TeleTracking. We utilize a lot of their standard reports. One of them that we typically use in transport a lot is the activity detail by job number. And that just allows you to see each job that's happening throughout the day, or the time frame that you're looking, where the delays may have been, and maybe some of the things that you can do a little bit better. We also have custom reports that we have built With the help of the teletracking team, we utilize Kyle's team, the Throughput team utilizes a lot of the unit level scorecards. We do have a lot of other reports that we rely on, and we look at them through an interdisciplinary lens, and we're able to say, okay, are we meeting our goals successfully? If we're not, we're able to kind of collaboratively discuss what can we do better? Where can we gain some efficiencies in our workflow, allowing us to kind of reduce some of the healthcare waste in our organization. So Heather previously mentioned our Discharge Hospitality Centers, which have been huge. One, they allow the patients to have a very comfortable space, waiting for whatever they might need, whether, again, it's a ride home or medications, or if they need some sort of assistive device to go home, they have that comfortable space that they can wait, but it allows us also to free up that room to be able to get to the next patient in there that's waiting, maybe in one of our EDs. To be able to move them faster. So we were able in 2022 to decrease our DHC volume by 1,732 patients, which was huge for us. That allowed us to save over, and we were also able to save over 200 inpatient bed days in 2023 with the use of our DHC. So in 2022, what does that look like for cost savings? So our total DHC patients in 2022 were 4,951. So after we looked at our total savings was over 400,000, and that was after we removed the RN salaries and benefits. Who we have RNs in these areas to be able to help our patients with that, whatever they might need while they're in the DHC. So that cost savings was significant for us, and that continued into 2023 too. We saw additional savings. So some other interesting information about our Discharge Hospitality Centers. Over 1,900 of over the 3,000 patients that went through the DHC in 2023 were transported by our patient transport team with an average completion time of 17 minutes. And then 6,500 of the over 32,000 patients that were discharged were backdated, we notice, with a backdated time of 54 minutes, which equaled 246.6 of dead bedtime days. So what else also helped us is we initiated a service level agreement with the transport team and our nursing team. We collaboratively got together to decide what should be in the service level agreement. And one of them was that the transport team would complete 70% or more of all discharges to help alleviate backdating of discharges and dead bedtime. We were a little bit over 50%, so we were great to see that in 2023, our transport team discharged more than about 50% of our discharges, which was up from about roughly 12% the years prior. So we made a huge impact working collaboratively again with our nursing colleagues to kind of get closer to our goal. And we're still trying to meet that 70%. We're hoping that we're successful with that this year. So what else has happened within this interdisciplinary team is we've kind of started to look at a future state and what do we want our future state to be. So currently we're building an offsite. We're building an offsite for our command center so we can kind of free up some space, valuable space in our hospital and move that team offsite. And with that, we're looking to get an outbound transport coordinator, an ambulance dispatcher, a Throughput operations centers MD. Currently, they are already doing Throughput operations centers huddles. We've expanded our virtual nursing program. And then we've successfully rolled out our auto dispatch to all the areas that we wanted to. PACU was the most recent. And we were successfully able to open and begin our transport team at our other hospital, which has been a huge success over there. And it's helped alleviate a lot of nurses having to transport their own patients, which is helping with dead bedtime. It's helping to notify our EVS colleagues when when the patient has left, so they can start cleaning the room sooner for our next patients to come in. And the other thing that we're starting to look at is RTLS to help us to gain even more greater efficiencies. So, and this is kind of a little, this is our small but mighty and growing transport team at Community. After we opened the transport team, we have seen an increase in the amount of transports being done. So our team will be growing, but it was very exciting and a rewarding experience to be able to begin this team.
Awesome. Thank you, Kristen and Heather. This has been incredible. We did have a couple of questions come through. So want to present those to you. The first question is from Karen. Her question is, how do you ensure that nurse-to-nurse report is given before the patient arrives using auto transport? We don't know what med-surg unit our patients are going to until the actual bed is freed up, so it can be done until the bed is assigned.
So that's a great question. We utilize our transport team. And when they get down to the ED, they ask those questions to the nurse. So they have 3 questions that they ask. One of them is, has report been given? So if report has not been given, we give them 10 minutes to be able to reach out to their colleagues to give the report. We're also working on an electronic report. So that's going to kind of be our future state to help alleviate the time that it takes to do the report. I hope that answers your question.
And then a follow-up to that is, are your patients discharged from your EMR before they go to the DHC?
I know that they're auto discharged from, there's time still from nursing to be able to enter what they need after the patient is discharged. So the nursing team still has time to be able to do whatever things that they need. But once transport has completed that request, they are removed. So they no longer look like they are a patient, if that helps.
Yeah, I'll take that, Kristen. They
Thanks.
are fully discharged patients that go to the discharge lounge. They remain in our EMR and a patient list, but they are discharged out of the system.
Okay, thank you. Another question just came through. How is the DHC staffed and what hours do you have?
The DHC is staffed by a registered nurse. We are open at our downtown location Monday through Saturday from 10 to 18:30, which is our peak discharge times. And then at Community, we're open Monday through Friday, 10 to 18:30. But both lounges are staffed by a registered nurse from our Throughput team. And when our Throughput team, when they're not in the lounge, also is out doing Throughput activities. They do admission histories and discharges and help transport patients as well.
Thank you. One thought I had, this is kind of going back to the beginning of the conversation, I was hoping we could go into a little bit more detail on, is you mentioned your dedicated Throughput team. Could you go into a little bit detail of who makes up that team?
Yeah, absolutely. So our Throughput team as a whole is our bed management team that does our bed placement. It's our transfer center team. And then we have a patient flow administrator, and she does real-time resolutions of throughput issues and delays. And then that below hers are our Throughput nurses, and they staff the discharge lounge, and they help on the units and throughput activities. Virtual nursing is also under our team to do virtual discharges. So it's a pretty big comprehensive team for both hospitals. And then, of course, we got the patient transport team in there, and then we work closely with EVS as well into our operations center.
Great. Thank you, Kyle. And then we got a follow-up to our previous questions from the audience, of what are the other two questions that the transporter asks, and that follow-up to if the report is given. And then I think there were those two other questions that they have to ask.
So one of the questions is are they on anything that would require a nurse to accompany the transporter? So there are a few patients that might, depending on our parameters, if the nurse needs to travel with the patient. And if there's any other specific information that they might need about that patient. So they have that dialogue with the nurse. And a lot of that is helpful because it starts that, if handoff hasn't been done, it starts that process faster. And we're able to then move that patient, and that transporter will wait a little while for that report to be given.
Great. Thank you. All right. I think that's all the questions that we have for now. But continue to send them in if anything else comes up. But Kristen, Heather, Kyle, thank you all so much. This has been great. Maria, was there anything else that you would like to add? You're muted.
Sorry, I had muted myself because I was so excited throughout the entire webinar of the great outcomes that they have been delivering. I've received some texts too from other clients watching saying, hey, I want to do this. So thank you, Upstate team. We'll be calling you for some reference calls, and thank you for your dedication and your leadership.
And that's it for today's webinar. If you have any questions or would like to learn more, head over to teletracking.com to speak with a teletracking representative. Thanks so much for watching, and we look forward to seeing you next time.